Hello again, this is Dr. Yates. Just wanted to give you a little insight on when a lot of patients have asked me on the internet, and you get it every day, how many grafts do I need? And that's a question that anytime you see a hair loss surgeon, they're going to say you need X amount of grafts. So a lot of people, I always ask them when they see me after they've gone on the internet or seen other people or just seeing me for the first time, a lot of people say, somebody said, Dr. Yates, that I need 3,000 grafts. And I'll say, well, how do you know that? And they say, I have no idea. They just told me I need 3,000, or I saw on the forum this guy had 3,000 and I want 3,000. So what we have to do is kind of go backwards and explain where these numbers came from, one, and then we figure out how much hair the person has, what the donor hair looks like, and then I figure out what's appropriate. And this is the way we do it, so you don't think that, oh, we just come in the room and say, you need 2,000, you need 800, you need 500. It's a little bit more scientific than that. The way it goes, if you divide up the scalp into 3 regions, this frontal region here is roughly around 70 centimeters squared. The middle one, or the mid-scalp, is about 60. The vertex in the back, which people always say, hey, I want the back filled, can get up to about 100. So that's a big number. So usually when people present, say a Norwood, whatever Norwood class, the area in here is, the total area is about 70, this is about 60, and the back can get up to 100. So that gives us the basis for the math calculation. When we plant hair, you want to have good density. What's good density? Good density is 25, say, to maybe up to 35 follicular units per square centimeters. So that's how we kind of get the math. Some doctors do higher density, meaning in the 40s and in the 50s, but I usually plant 25 to 35 follicular units per square centimeters. So if you do the math, if somebody comes in who's completely bald in this frontal region, they will take almost up to 1,700, maybe up to 2,000 grafts just in this area. So these are the things that we take into consideration. If there's existing hair here, the size of this area, and we actually measure this area so we can come up with an accurate calculation. Maybe it's less than 70, maybe it's greater than 70. Every head is different. So if this person says he needs 3,000 and wants to work in here, another person might need 2,000 or 1,500. It depends on the existing hair that's left, the desired density that you're going to plant at, and of course, how big this area is. Same thing with the mid-scalp area. Usually the mid-scalp on most people, this area is preserved usually, but we still will plant through this area as well. The back is a sphere. It's much larger than you think. It can take a large amount of grafts. If it got up to 100 centimeter squares, you can plant 2,000 to 3,000 grafts in here. Now the average donor, the book says, has maybe 6,000, maybe 7,000 donor hair. Sometimes FUE specialists are able to increase that number because we can extend into the temples maybe to 8,000 grafts. But you can see if you did the math and you wanted to do all 3 areas, you would be at least at the 6,000 to 7,000 graft mark with the density of about 25 to 30 centimeters squared, of grafts. So you can see it takes a lot of hair to go through all these areas. So when people come in and I suggest, let's work through here, because this is all people can see. When they see you from the front, depending on the shape of your head, and everybody's head is shaped differently, I look to see where you can't see any further back than that. And then I want to concentrate in here, not neglecting this part, but first we want to concentrate here to frame your face. We'll measure this, see how big it is, see the existing hair that's left, the donor hair, see what I think the anticipated loss is going to be, and then we'll do the math. And usually this works out well, but I think everybody who has a hair transplant, if they say they need 3,000 grafts, they should understand why they need 3,000, that it just didn't come from the sky. So hopefully this helps. This is Dr. Yates with some basic math kind of diagnosis on, hey doc, how many grafts do I need? Thank you.